Back in September last year, I heard about the privatisation of the hospital on the radio while I was driving to work. We had no previous indication that this was going to happen. It was just released by Minister Skinner apparently overnight, and we found out through the media. We were wondering what would happen with our jobs, with the hospital itself, with our entitlements, and what would happen with our community and our ability to give them the best possible treatment.
When we initially found out about the privatisation, a few of our branch members were very quick to jump on social media, and we formed the Keep Our Hospitals public page, and we found that to be a really great sounding board for people to ask questions and for us to provide information. Within a matter of a few weeks, we had up to 24,000 members of our community, ranging from Newcastle down to Sydney.
We tried to get our message out there to say that this is what the government's plan is as far as we're aware, and this is why it's not going to work for our community.
And our campaign was widely focused on the community because that's what we as nurses are. We're here there for our community and for our patients.
So the rally was really a massive collaboration between members, community members and the union, as well as local parliament members. That community had built that hospital, they had funded the hospital, and there's local community groups that still help to fund some of the equipment that we get.
We had a huge amount of community support, real grassroots community support, you know, everyday people who previously probably weren't very politically involved.
We did lots of door knocking, collecting signatures, campaigning, talking to large groups, contacting our local Lions clubs and community clubs. We posted on our social media that we were going to start chalking our own cars with the message, Wyong Hospital not for sale, and we got a huge response from that, and you could see within the area that we live all of these cars popping up with chalk written on the back, Keep Our Hospital public, Wyong Hospital not for sale.
We had the knowledge base of the union, we had the creativity of the members of the branch.
So we're extremely lucky to go to State Parliament to basically put forward our motions of 10,000 signatures that we'd collected, and to say that no one was happy in the community about this.
Even from the forum that we had, we could see that the community was behind it. They were active, they were asking questions. And that fantastic question from one of the community members asking for a shining example of a PPP was absolutely brilliant.
My understanding is Northern Beaches is working well. I mean, it is still being developed. So you asked for an example. I'm offering that to you as an example.
For us to garner that amount of community support, it was purely us getting out there on the streets and talking to people one-on-one.
We couldn't have done it without the support of our organisers and the association, and we had really great support from some of our local political leaders. When we found out that the hospital was no longer going to be privatised, everyone was just elated, they were so happy.
It was the best feeling going to work, just getting big hugs and smiles from everyone and seeing that morale increase.
All our jobs were safe, the community members were happy, even the management were excited. So it was good to see, and it really joined us all together, the community and the workers of the hospital.